Doctors across the United States are trending on Twitter under the hashtag #ThisIsOurLane in response to the NRA. This tweet from the National Rifle Association said, quote, "Someone should tell self-important anti-gun doctors to stay in their lane." Half of the articles in Annals of Internal Medicine are pushing for gun control. Most upsetting, however, the medical community seems to have consulted no one but themselves.
That was in response to a recent paper written by the American College of Physicians, an expansion of another paper with a list of recommendations to prevent gun-related injuries. So joining us now on Skype is Dr. Megan Ranney. She's the co-founder of the American Foundation for Firearm Injury Reduction in Medicine. And a warning, some of the images that we're going to be showing might be a little graphic for some people. So, Doctor, thank you so much for joining us. Hundreds of doctors are sharing their stories under the hashtag #ThisIsOurLane. Tell us what prompted you to write this response and what your experience has been in the emergency room.
Absolutely. So as doctors, we are the ones who not only take care of the victims of shootings, right? And there's absolutely an epidemic of gun violence across our country, but we're also the ones who can solve it. We as physicians not just treat victims and console parents, but we also have a science of public health that we use to solve epidemics ranging from car crashes to Ebola, right? We have techniques that we can use to fix problems like gun violence. And so for the NRA to tell us to not be involved just isn't appropriate. We are involved every day across the United States.
And Dr. Ranney, I've been watching all of these social media traffic with some fascination and interest, because there are so many doctors now on social media and now on television who are talking about this. Your peer, Dr. Esther Chu, has been very vocal. Dr. Julie Melnick went and spoke to Christiane Amanpour. And I want you to do for us at CBS News what she did there with Christiane, which is to talk about when somebody says stay in your lane. Dr. Melnick talked about the fact that you are the ones who have to counsel grieving families. You're the ones who have to pull those bullets out of the wounds of individuals. Talk us through your responsibility to gunshot victims.
Absolutely. As an ER doctor, I am the first and sometimes the only physician to touch a patient who's been shot, right? And that's for those who are lucky enough to make it to my doors. Paramedics out in the field see far more than I do. As someone who's caring for a victim of a gunshot wound, my priority is saving their life in that moment. When I can't save their life, it's then my job to go and talk to the family and to help counsel them not just on the immediate after effects of that injury, but on all of the psychological trauma that it causes among them and their families. For those who survive, they're of course often left with lasting psychological and physical trauma. But here's the thing, as doctors, we don't just take care of patients in the moment. We also put our brains and our hearts and our willpower to fixing problems like this, to preventing them before they start. We would never look at, again, taking Zika or Ebola epidemics and say, well, it's happening, we're just going to accept it. We do research and we find ways to stop epidemics, to stop the influx of patients through our doors. And that's what we're looking for here.
You know, periodically, we in the news will cover crime statistics. You know, so the numbers will come out. Oh, this crime is down, this crime is up. And, you know, often homicide is down and there's a celebration over that. And I always like to sort of remind people that, you know, often homicides are down because the doctors are incredibly good at what they're doing, that people who may have died 10 years ago are not dying because we have incredible doctors. But the crisis is still there. Do you consider this gun violence a health crisis?
Absolutely. This is undoubtedly a public health epidemic. We have over 100 people who are killed and over 200 who are injured every day across the United States. That's almost as many as the number of people who are dying from opioid overdoses, right? So it's incredibly important for us to deal with this as the epidemic that it is.
So, Doctor, what can the government do to assist doctors in treating wounds, and what's the solution?
So I would say the best solution is to prevent the wounds before they happen. We, as a community, we're not anti-gun. Many physicians and other healthcare professionals are gun owners. What we are is anti-bullet hole. We are pro-gun safety. And where we are determined to work, with or without the government, is in finding prevention solutions, some of which may have nothing to do with guns, some of which may be things like greening vacant lots or providing mental health services. But we know that there's a way forward and a way to prevent this.
Doctor, one last question. I spoke to a reporter who covered the Vietnam War on television, and he made a point to me that I wonder if you can comment on. He said, you know, when Americans started to see the body bags coming back from Vietnam, when they started to see the actual situation that our soldiers found themselves in confronting the Viet Cong, that is when public opinion began to change about America's participation in that war. Do you think now, in all of the coverage of all these mass shootings that we in the media do, that it is perhaps that there is an opportunity, and I know that it's not something that would be done, but to show people through our cameras, through our lens, what you actually sometimes see when they enter into your emergency room? Do you think that we need to go at that level to get people to understand that it's not just thoughts and prayers that will help these individuals?
Mm-hmm. So I think that we always have to be careful and put the patients and their families first. There are certainly some families who've been vocal about wanting to share the aftermath of gun violence. But my biggest priority as a doctor is protecting my patients and their family and to develop solutions that can help them. I don't know that sensationalizing the images are necessarily the answer. Again, my biggest priority is making sure that my patients are safe and protecting them from harm.
It's a good point. Thank you, doctor, for that illumination, because it's something that some people are talking about, saying that if people would be more aware, that might make them sort of be more understanding of some of the positions that other people have had in this debate.
But, who's going to watch a show like that, or who's going to? It's
I know. But this was war, and they were seeing those images.
Yeah.
Totally. But I think the solution there, like for war, the solution is partly for us to take action, and that's where Affirm, the group that I co-founded, we really are there to work with private citizens to fund research to help change the trajectory of this epidemic. We know that we can solve this, with or without government. We'd certainly love to have the NRA along. We have many gun owners that are part of us. I think there are other solutions out there.
Great. Thank you so much, Dr. Ranney, for spending some time with us. We really appreciate that.
Thank you.
Coming up.